Dr. G is becoming a patient now. How does it feel?
It's happening.
Hi, I'm Dr. Manu Gujrati, and I am a surgeon with expertise in the field of hair restoration. So I began my training initially in medicine in the field of head and neck surgery. And from there, I further specialized in facial plastic and reconstructive surgery. And my mentor, who I greatly admire, also taught me about the evolving techniques of hair restoration and hair transplant surgery. And what I think is the most unique about hair transplant surgery is it really is the culmination of true art and science in medicine. And that, to me, was the best fit for who I am as a person and as a surgeon. Hair, for people in general in society and across cultures, for me, always has represented the inner vibrance of the soul. And so I think hair has a really big meaning to who everybody is as a person. And that can vary from person to person, but it has some meaning to everybody. So with the benefit of youth, I thought I'd never need this when I first started. And I thought, as a surgeon and expert in the field, I knew how to, what medicines and treatments I could do to prevent this and slow it down. And I have. I've definitely kept a lot more of my hair at this age than my father at the exact same age. I've looked at pictures, so I've compared. But eventually, I started to see that there were things changing with my hairline. And I started spending more time in front of the mirror to kind of make my hair for the day the way I want it to look. And it kept getting, taking a little more time, a little more just me being nitpicky about how I want my hair to look. And I started to think, well, what do my patients say to me when I ask them, well, what did you first notice? And they say, it just took me a little longer every day in the mirror to get my hair the way I wanted it to look. And then it's just, there was a day where it hit me like, wow, if I'm spending this much time, something's really changed. I want to be able to get up in the morning or get out of the shower really quickly, just, dry my hair and not take so much time to make it look good. And that's easy when you've got the right amount of hair there. When you start losing hair, that becomes harder. And that's when it hit me. I'm losing my hair. And as a surgeon, that was a moment of, reality check, humility, something where it's like, wow, I know my patients go through. And I do pride myself on being very empathetic to what all my patients are experiencing. But it changes when you really put yourself in their shoes, literally. And that's what I feel like at this point, why would I not? I believe in what we're able to do for patients. Look, the technology and the way we're able to do things now in hair transplant surgery has changed leaps and bounds since when I first trained even. And because of that, it is not even a question for me. It is something I know that I can get a result that is natural, absolutely the way I think it looks right for me. Since the moment that Dr. Mohebi and I met, and I made the decision to join the team at Parsa Mohebi Hair Restoration, it's been an awesome adventure. We naturally think alike. We're passionate about our work, and we are very curious individuals.
Look, it's not the first time we've talked about it, right? And there's been moments where I brought up and you're like, yeah, you need to do it. But I think
Did I push you to do that?
No.
You wanted to do it.
Yeah, I mean, this is something, I told a story thing. The story is that I've been thinking about it like, how am I going to do this to myself because I trust me to do it?
Right.
And it wasn't until we finally brought everything together that I'm like, okay, finally I have another set of hands I can trust.
Good,
right?
good. Oh, but that's good.
So
that's a good sign.
And I think that now it's like, time is right, just work-wise, whatever. And I don't have, it's like I've let go of no, I can stop this from happening, whatever. I just need to get out of this.
Right. So you accepted it.
Right. You've seen pictures of Dad. You know what he's at. Mm-hmm. So he's that's my worry. Like we tell our patients is that could be as bad as it's gonna.
You know why you think that like that? Because you know what's going on. You're a doctor, right?
Yeah.
A lot of patients I've seen, they know I'm asking about their dad male side, mother side, father side family, they still act surprised when I say, okay, this is where you're heading. I'm Dr. Parsa Mohebi, Medical Director of Parsa Mohebi Hair Restoration. I'm very excited to do a hair transplant on our very own Dr. G. Dr. G is the Medical Director of Parsa Mohebi Hair Restoration office in San Francisco. Dr. G has always been wearing his hair long, so he's known with that look. But then in the last few years, he's been noticing that his hairline is getting receded or fading. So it's not as solid as it was before. The temporal points are going back. So he has a male pattern hair loss, he has a family pattern for it, and in microscopic evaluation, we know that he's gonna lose more hair in front. So he wanted to take care of it as soon as possible. So we're expecting to do one procedure and get a reasonable coverage and density in front and temporal points areas.
I've got that nice, I would like to call it the M shape. It pertains to both of us. PBM Manu.
That's right.
So, yeah. Yeah, it's like, I can't remember when, my forehead was, even that strong. Well, it's been a long time.
Yeah.
Yeah. So in my culture, personally, the head's actually shaved when you're a very young child, usually as an infant or toddler. So I actually had my head shaved the one and only time was when I was 3 years old, and my mom actually took me from Chicago to India. It was my first trip to India, and we went to the holy town of Varanasi. And my mom and two of my aunts, we literally took a rowboat out to a temple in the middle of the river, a very holy site. And as I sat in my mom's lap, not knowing what was happening, a priest did a ceremony where my head was shaved. To shave that hair away when the child has grown up enough gives them sort of a clean slate on life. And so since I was 3 and had my head shaved, I have not ever shaved my head again. And as I look at it now in the context of shaving the head for my procedure, to me it kind of feels like getting that clean slate again.
So Dr. G is doing his hair transplant procedure, and I have the pleasure of being his surgeon. And in the process, he is coming up with this great idea of donating his long hair that has been grown for 7 years. So we have been in touch with this company who is accepting hairs and use them for people who lose hair for medical conditions and they cannot even do hair transplant or any other procedures. Now that we did this beautiful hairstyle, how does it feel that this hair needs to be cut and sent to charity?
Part of me wants to keep the look.
Hi. I gave your son a nice pigtail before we cut him and send him to the charity. How do you like this? Did I do a good job?
That's a good idea. Oh my God, they are 15 inches or what?
Yes, almost 15 inches. You're right on, actually.
Oh my God.
Yeah. So we're gonna cut it. Do we have the permission to cut these?
Yeah, sure.
So this is gonna be just something like that. So we're gonna send 4 pieces, wrap them, especially together, and send them to the organization that prepared the hairpiece.
It's so interesting to have it short again.
Donated hair
Donated.
has been done.
We're good to go. Let's go. At the beginning of the procedure, we have to mark the areas that we want the hairline to start, and then we want to make it irregular in certain areas. We want to make sure it's not 100% symmetrical either. We're talking about macro irregularities and micro irregularities. So those are all making the hairline look perfectly natural. In terms of this procedure, we have designed the hairline to resemble a very youthful hairline, not a juvenile. So it's going to be a mature hairline. The corners are going back a little bit, but the temporal points, we want to make them nice and solid, so that makes that youth to the overall look of the face.
Well, the team is going to go ahead and shave it off so we can get ready for surgery. Are you ready?
Okay.
Am I ready? Yeah. All going away.
How do you feel?
I mean, I was ready to let it go. It took me time. but it was a good reason. We donated it. I can see the features of my face. My eyes are still there, my nose and my lips, beard, like chin line, like my jawline, it's still there. So there's just a lot more air flowing up here.
We take patient to procedure room and start with sedation, keep them comfortable, and local anesthesia, make them all numb so you don't feel anything during the procedure. The next step is going to be to make sites. We design the holes, the tiny, teeny incisions that grafts will go into. So that will be done one at a time, and we change direction, distribution, and curvature of hair from area to the next area, and that will make it perfectly natural the way people expect to see it.
As an expert and a devoted surgeon in the practice of hair transplant surgery, I already feel incredibly passionate about what we do. Now, after I will have gone through my procedure and gone through the healing process and had my hair start to come in, I think that's the only thing that could possibly make me more passionate and connected to this than I already am. And to really be able to sit with my patients and tell them this is exactly what it's going to feel like. This is what you're going to go through. I can say that now because I've seen so many patients through it. But I've had many patients come to me over the years and say what they really want before their surgery is to talk to somebody who's had it done. And so luckily we've been fortunate that a lot of patients over the years that have had procedures with us have agreed to speak with potential patients about their procedures. It's obvious for me as a surgeon, as a physician, as a doctor, I trust this process. I trust it so much, not just to do it for my patients, but to have it done to me.
After all sites are made, we are changing patient's position and start extracting grafts and placing the grafts at the same time. We use a device called Mohebi Inserter that I invented. So as the grafts are coming out, one of the technicians collects them and another one count on the microscope and sort them out, and two technicians place the grafts at the same time. So that minimizes the time the grafts are sitting out of the body and improves the survival of the grafts and final result.
We should be halfway done. Usually, Dr. Mohebi and I would stop at a reasonable time where half the donor area has been harvested, and we've given the staff a chance to catch up and put in all the grafts that we've gotten from the first part of the harvest, and gives the patient, myself, a chance to kind of just relax the muscles, kind of adjust again from being in different positions. Obviously, we haven't eaten this morning, so it's good to get something in. And we try to, have a little bit of relaxation time and then get right back into it.
For some people, hair loss can be a sign of wisdom. For other people, especially when they notice it happening early, it's about looking yourself in the mirror and not seeing who you think you feel like on the inside. And honestly, the more doctor answer to that is that hair is what frames your face, and if the frame starts to change too early, it really can change how you see yourself and how others see you. And your face is the picture to who you are, and so you want the frame of that picture to be the best fit it can be.
Done. It's actually, doesn't feel like it was that long a day at all. And that's exactly what our patients say. It's weird to experience it for yourself. So now I'm just going to go home, rest. My job today is to just take any pain medicine if I even need it, and then keep my head elevated as I sleep tonight, and make sure I protect those grafts. I don't scratch or rub on them. And then tomorrow morning, I'll come by the office, and the staff is going to help me do my first hair wash. I had my procedure yesterday in LA, and I stayed overnight, and this morning I had my hair wash. Our staff at the clinic went ahead and did my first hair wash. So after that, I packed up and I was in my car and drove right on back to San Francisco.
We would like to see patients day one after procedure to give them hair wash and show them how to wash hair, how to prepare it, how to clean it, and then they can take care of it at home. And then 2 weeks after procedure, when is the time that the redness is a little less, the scabbing is gone, so patients can see a preview of what will be happening in the future. So that's a preview of future result of hair transplant.
I've been asked a lot what's my favorite part about being a hair transplant surgeon. And it's honestly, it's the same thing I think that any doctor or any surgeon would say. It's making people happy, bringing happiness to their lives. I like to say to our team that we are in the business of happy surgery. And that's the truth. In hair transplant surgery, maybe more than anything else, that's what we do. We're bringing an element of joy back to people, and an element of completeness and wholeness. But there's nothing like being able to see a patient through from early on when they're dealing with their hair loss and facing it, making the decision to actually go through with surgery, and then the excitement that they come back to us with when their final results have come in. It never gets old.